I've gathered my equipment. I've washed my hands. We're in a secure, safe environment with privacy. My name's Hallie. I'm going to perform a head-to-toe physical assessment on you. Can you tell me your name and date of birth?
Sandy Funk, 8/16/1967.
Okay. Blood pressure was 120/63. Heart rate was 72. Temperature was 98.7. Respiratory rate was 16. And pulse ox was 100% on room air. Speech is clear. No obvious signs of slurring. Face is symmetrical. Upper extremities and lower extremities are also symmetrical. Patient has good apparent state of health. No obvious signs of body odor. Good hygiene noted. Affect and mood is appropriate for this occasion. And we're going to go into our cranial nerve assessment. Cranial nerve 1 is olfactory, which is smelling. So I'm going to include a nostril at a time and tell me if you smell, okay? Okay. Cranial nerve 2 is optic, which is vision, and cranial nerve 3 is ocular motor, which is Perla, pupil equal round activity to light accommodation. And her pupils react equally to light. Cranial nerve 4 is trochlear, which is movement of eyes. Can you put your eyes inward? Okay. Cranial nerve 5 is trigeminal, which is sensation of forehead. Can you feel that?
Mm-hmm. 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 Mm-hmm.
Cranial nerve 6 is abducens, which is moving your eyes side to side. And cranial nerve 7 is facial. Can you smile, frown, show your teeth, puff out your cheeks, squeeze your eyes really tight, and raise your eyebrows? Okay? Cranial nerve 8 is vestibular cochlear, and I'm going to whisper in your ear and tell me if you can hear it.
Mm-hmm. Mm-hmm.
Okay? Cranial nerve 9 is glossopharyngeal, which assesses taste sensation and tongue strength. What do you taste?
Salty.
Okay. Cranial nerve 10 is vagus, which is gag reflex. Can you gag for me? Cranial nerve 11 is accessory, which is, can you shrug your shoulders and turn your head towards me and the other way? Okay. Cranial nerve 12 is hypoglossal. Can you stick your tongue straight out for me? All right, there you go. So I'm going to assess your head, just inspecting for any lesions, bumps, and your eyes, nose, mouth. Can you open your mouth for me to see your throat? Okay. And now look for your oral cavity open. Do you have any dentures?
No.
Do you have any difficulty swallowing?
No.
Mm-hmm. And trachea is midline, no deviation noted. Okay, I'm going to go into the respiratory system. No obvious signs of facial expression with difficulty breathing or posture seems appropriate. Inspect for rhythm, paced evenly, no difficulty breathing. Assessing posterior and anterior for usage of accessory muscles, which she isn't. Okay, I'm going to take a listen to you. I'm assessing for bronchial. And bronchiovesicular. And vesicular. Can you set up for me? Bronchiovesicular, bronchiovesicular, and vesicular. Alright, and lean back. Alright, Do you have any difficulty breathing, any shortness of breath that you notice?
No.
Okay. We'll go into your cardiac assessment. Listen to aortic, which is second intercostal space, right of the sternal border. Pulmonic, second intercostal space, left of the sternal border. Erb's point, third intercostal space, left of the sternal border. Tricuspid, which is fourth intercostal space, left of the sternal border, midclavicular. And mitral, just fifth intercostal space, left of the sternal border. Alright, see no obvious signs of edema. Extremities are warm and dry. I'm going to assess for pulses, temporal, bilaterally, brachial, radial, femoral, and popliteal. And posterior tibialis, and pedal. And pulses are strong and bilaterally equal. Check for cap refill. Less than 3 seconds. I would check for cap refill on our toes, but they're painted, so we'll be able to see it. Alright, so I'm going to go into GI. Are you tolerating food fine?
Yes.
When was your last bowel movement?
This morning.
Present bowel sounds. Just going to take a look at your abdomen. No distension. Is that tender at all? Am I palpate? Is it tender? Alright. How are you voiding? No difficulties voiding?
No.
No increased frequency burning?
No.
Okay. And what color is it?
Like clearish yellow.
Okay. The patient has no Foley and there's no distension of bladder. So I'm going to go into your skin, just assessing for any lesions. Skin is intact, no redness noted. Skin is dry. Alright, so we're going to do musculoskeletal. I'm going to do active range of motion on you, so I'm just going to passive range of motion. There we go. Okay. Can you put your finger to your nose? And the other side. Alright, can you stand up for me? Are you dizzy?
No.
Can you close your eyes for me? Performing the Romberg's test. No swaying. Alright, can you hop on one foot for me? And the other foot? Okay. Can you put your hands out and turn them as fast as you can? Okay. Equal bilateral. Alright, can you get back in bed for me? Okay, and squeeze my hands as tight as you can. Muscle strength, full resistance bilaterally, and push. As well as lower extremities, full strength bilaterally. Okay? So we're done with our physical assessment. Are you comfortable?
Yes.
Are you in any pain?
No.
Okay, I'm going to wash my hands